Hey everybody, welcome to Faith Over Fear. It's week 6, November 29th. It's the Monday after Thanksgiving. I hope everybody had a blessed holiday. I hope you enjoyed time with your family, with your friends. I know that I did. This week we're going to be talking about choosing faith over fear when it comes to COVID-19. Obviously, this is a huge topic in the America landscape and a lot of different landscapes. And honestly, this topic is really what wanted to push me into starting this podcast. I know for the past 2 years, we've been fighting COVID-19. There's a lot of misinformation coming out from the media, social media, the news networks. There's a lot of people who misunderstand what's really going on and pushing certain ideas for their own benefits. So I just want to take time this week to start what we're going to go through for the next 2 or 3 weeks about COVID and how we should handle COVID and what's really going on with it. So this week we're going to talk strictly numbers. I'm not going to give you my opinions. I'm not going to come in here and try to force you to believe something. We're simply going to be talking about the numbers, because I think that if everyone had the true numbers of what was going on, I think that you could begin to form your own opinion about what has happened in the last 2 years. I want to start by saying we have chosen fear over faith when it comes to this virus. And that's what we have to change in this country, and that's what we have to change in our own lives. I'm not downplaying the seriousness of this virus. I'm not downplaying the seriousness of it taking people's lives, and that there's families out there going through losing lives from this virus, and I understand. My heart goes out to those families, and I'm going to continue to pray for those families. But my heart goes out to anybody that loses a family member, regardless of what happens. And I think what we've done is we have spit so much negativity of COVID that we have gotten to the point where we're even scared to step outside, scared to live our lives. You can't take a mask off. You can't just walk outside. You can't drive in your car. You can't go to work. You can't do any of these things without the risk of spreading or getting this virus. But the thing is this is no different than any other time in history. None of us are guaranteed tomorrow. It doesn't matter what we do. We're not going to stop people from dying. We can't do it. We're not God. I understand that there's steps that we can take to keep ourselves safe, and I encourage people to do that. But I encourage you to do it with facts, and I encourage you to do it speaking to true medical officials and not listening to what CNN tells you or MSNBC or Fox or anybody on Facebook or the news. You need to talk to your doctor, and you need to just know the numbers. And again, that's this week, we're just going to talk about the numbers. I'm just going to simply give you the numbers. So we're going to start. As of right now, and this is a running total, so this is almost for 2 years. In the United States, we've had just shy of 48 million cases of COVID-19. 48 million cases. Of that 48 million cases, we've lost 774,500 people. If you take the percentage, that is a death rate of 1.6%, and that's of cases. So what I'm saying is, out of the cases, if you got COVID-19 in America, if you got the virus, you had a 98.4% chance of surviving. And majority of this time has been without what they say a vaccine or treatments. 98.4%. 98.4%. Now, if you look at the world, the global case count was just over 258 million cases globally, with deaths of 5.16 million deaths. That's 1.99%. So that means on a global scale, understanding that most places in the world do not have medical advancements like we have in America, on a global scale, you had a survival rate of 98% from this virus. 98% globally. Now, if you look at how many people are in America, 328 million, roughly, and you take how many people have died in 2 years from COVID, it's 0.23%. Globally, if you do the same numbers, you're at 0.066%. So if you're hearing these numbers, what does that mean? That means that a virus that we have been told to be scared of, to be deathly afraid of, has a survival rate of 98+%. 98+% for majority of people. Now, again, I'm not saying don't take it serious. And I'm not saying that for some people, you have to take it more seriously than others. But what I am saying is that the average American, the average healthy individual, should not be scared of 98% survival rate. We as humans are going to get sick. It's inevitable. So I want to dive in a little bit further. So this week, I don't want to really talk about vaccines and the masks. That's what we're going to talk about in the next episode. I just want to continue to talk about cases and deaths. So as of November 2021, if you break it down by age, and the categories go from 0 to 17, 18 to 29, 40 to 49, 50 to 64, 65 to 74, 75 to 84, and 85 and older. So if you break down the deaths of the almost 775,000, 97.6% of deaths came from people who were older than 40. Roughly 93.5% came from people who were older than 50. Now again, and I'm going to say this a lot through this episode, I'm not saying to downplay this. What I'm saying is that if you're older than 50, if you're in that age range of the 50 and older, you should probably talk to your doctor about what you need to do in preventing this and treating it if you were to get it. If you were under 39, the deaths were 2.4%. Under the age of 40, it made up only 2.4% of the total deaths of COVID-19. That's roughly 5,000 people under the age of 40. Well, then, if you also go through, and you can go to the CDC, you can go to the CDC's website for this, and you can go to Reuters, because they fact-check this. A report came out early on from this that said that 6% of people who died from COVID-19, their death certificate said only COVID-19. So that means that the other 94% of people who had died from COVID-19, they had other underlying conditions. They said that 94% of deaths from COVID-19 had 2 or more underlying conditions. Now, what does that mean? That doesn't mean that COVID-19 was not the cause of death. What that means is if you were already on underlying issues, you already had health issues, then you should take it a little bit more serious than people who don't. Because what we know through these numbers is that if you have an underlying condition, you are the one that are at high risk. Not the healthy young individual. Not the healthy individual, period, honestly. 94% of people who died from COVID-19 had 2 or more underlying conditions, regardless of the age. So if you are a healthy individual, statistically speaking, medically speaking, there's nothing to be scared of. There's nothing to be scared of. And if you're under 40, there's absolutely no reason to be scared. None. From the CDC, July 1st, 2021, from March 2020 to March 2021, severe COVID-19 illness in adults has been linked to underlying conditions. So people who are already ill, people who are already fighting illnesses are the ones who are more susceptible to COVID-19 and having a hard time fighting it off. But that makes sense. Anybody with underlying conditions, you're going to be at a higher risk for a lot of sicknesses and illnesses. And that's why it's important to take care of yourself and to take preventatives from anything. Flu, COVID, the common cold, any of it. They did a study and said 800 U.S. hospitals ages 18 and older, there was roughly 4.9 million people in the hospital. And this was for 2020. you roughly had 4.9 people put in the hospital. Of that 4.9 million, 541,000 were put in because of COVID. That's 11%. Only 11% of the total hospitalizations were from COVID-19. And of those 11%, 95% of those people had underlying conditions. That could be diabetes, that could be cancer, that could be heart disease, that could be a number of issues. Obesity, that was a big one. That is who is being heavily affected by COVID-19. And so what am I saying here? I'm saying that this honestly is not much different than anything else we've faced in the past for majority of America, for healthy America. In 2020, heart disease was the number one cause of death in America at 690,000 people. Cancer was number 2 at just shy of 600,000. And COVID came in at 3 at 345,000 people. So heart disease doubled the amount of deaths than COVID-19. But I don't see everyone bailing out of the drive-through lines at McDonald's, at Burger King, at Wendy's, Krispy Kreme, or how about alcohol? How about drinking? We live unhealthy lifestyles in America as a luxury in this country, but we don't want to give those up. I watched in the middle of this pandemic when we knew that obesity was one of the highest risk categories for COVID-19. They were saying, get the vaccine and we'll give you a free donut a day just to be vaccinated. People giving out free 6-packs of beer, free fast food. You're going to give away the things that we know are unhealthy and we know that are going to cause more issues with this virus, but we don't want to talk about that. We're going to push that aside. The news networks won't talk about that. Social media won't talk about that. And so when you push all these facts to the side, you push away the numbers, everything that we've talked about today, you push all these aside, then it's easy to pick fear over faith. Because our top figureheads are telling us that by simply walking outside and breathing air, you have a chance to die. And let me tell you something, they're right. They're right, but not from COVID. We get in our cars and we drive to work every day. If you get on the interstate, you have a chance of being in a fatal car accident. You get on a plane, you have a chance of being in a plane crash. It's a small chance, but so is 1.6% chance from COVID-19. We have chances all around us. We have chances all around of ending our lives. And the hard truth of it is none of us are promised tomorrow. So what I want to encourage you with these numbers, and in COVID part 1, I want to encourage you to find the numbers. Don't listen to the news. Don't find your information on social media. If you want, email me, tyler.faithoverfear@gmail.com. I've got all my resources. I've got links to everything that you can read if you want to know what the numbers are. I want you to choose faith over fear. It's time that we take our lives back. It's time that we take our country back. And it's time that we get back on the track of succeeding in this country instead of failing. It's time that we get back on track in this country of choosing faith over fear and not living our lives scared of what's going to happen if we contract the virus. Again, I want to encourage any of you out there listening that may have lost a family member to COVID, or if you've lost a family member to anybody or for anything in the last 2 years, my heart goes out for you. I'll continue to pray for you. And again, you can email us if you want prayer requests. But for the people who've lost their businesses, we've had families lose their livelihoods over this. Over a virus that has a 98.4% survival rate in the country. Now we have treatments. Now we have vaccines. It's time that we get back on track. It's time that we pick faith over fear. I want to encourage you guys, faith over fear. And don't be scared to talk about the facts. Don't be scared to throw out these numbers. Facts don't lie. These numbers don't lie. And like I said, I've got the resources. I've got the links for you guys. If you're getting in these discussions and you just want to know and be factually right in these conversations. But I want to encourage you to go and have these conversations so that more people can understand what's really going on and understand that it's okay to choose faith over fear in this situation and in this time. Next week, we're going to go into the vaccines. We're going to go into the masks. And we're going to go into the holiday season, spending time with family and what it looks like during a pandemic. Guys, I really appreciate you taking time to listen to us this week. I know that this is going to start getting a little controversial. I appreciate the support. I appreciate you listening. And guys, please share this with your friends and family. Don't be scared to put this out there. Not for me, not for my benefit, not for my glory, but so that we can create a community that is choosing faith over fear. I appreciate you guys. Like I said, find us on Facebook, share our page, like us, listen to us on Spotify, Apple Podcasts, wherever you listen to your podcast. Share it with your friends, share it with your family. Appreciate it, guys, and we'll see you next week.